Hi everyone, welcome back in today's video. So in this tutorial we shall be discussing how to give intramuscular injection, especially the gluteal muscle. So there are different types of intramuscular injection. We have the deltoid muscle, we have the gluteal muscle, and we have the vastus lateralis muscle. So in this video we shall be discussing how to give intramuscular injection, especially the gluteal muscle. So before you start injecting the medicine, first you have to locate the site where you are going to give the shot, where you are going to give the injection. So when you look at the anatomy of the gluteal muscle, here is the iliac crest and here is the lower trochanter. So for you to give the injection, first you have to draw an imaginary line that is horizontal or a vertical line for you to give the injection. So when you're giving the injection in the right side of the body, so you give the injection in the outer upper quadrant of the gluteal muscle. So how will you locate? Let us see now. This is how we are going to locate. So you draw an imaginary line that is vertical and horizontal line like this. So you draw an imaginary line that is vertical and horizontal line. So the injection is given in the outer upper quadrant of the gluteal muscle. So this is where you are going to give the injection when you're giving the injection in the right side of the body. So this is how you are going to give a gluteal muscle, especially when you want to give the injection in the right side of the muscle. So you draw an imaginary line that is a vertical and horizontal line. So the gluteal muscle is divided into 4 quadrants, 1, 2, 3, 4. So the injection is given in the outer upper quadrant of the gluteal muscle, especially when you're giving the right side of the body. So how will you give the injection? For example, you hold your needle 90-degree angle into the muscle. So you insert the needle deep 90-degree angle into the muscle. Then when you insert like this, you hold the cap of the needle, then you aspirate, you withdraw back the plunger. So you pull back the plunger to ensure if there is a blood, if there is a flashback. So if you see a blood, you withdraw back the needle, you start a fresh injection. Because if you see any blood in the hub of the needle and if you inject that, so you may damage the nerve cells in the gluteal muscle, so that will be dangerous for you. So when you insert 90-degree deep angle into the muscle, you withdraw back, you pull back the plunger to ensure if there is blood. If there is no blood, you give the injection safely, slowly like that. Then you apply a cotton wool on the area where you have given the shot. You apply a cotton wool like that. So let me repeat the procedure. So you hold the needle 90-degree angle deep into the muscle, you insert like that. First you grab the skin. So what you do, you grab the skin like this, you insert the needle 90-degree angle deep into the muscle, then you hold the cap of the needle, you release the skin, you aspirate, you pull back the plunger to ensure if there is a blood. If there is no blood, you can give the injection safely like that. If there is a blood, so you pull back, you remove the needle, and you start a fresh injection. So this is how you are going to give intramuscular injection, especially the gluteal muscle. So what about when you're giving the injection in the left side? So this is how you are going to do. You draw an imaginary line that is a vertical and horizontal line in the left side of the muscle. So this is how you are going to draw. So you draw an imaginary line like this. So the injection is given in the outer upper quadrant of the gluteal muscle in the left side of the body. So this is how you are going to give the injection, especially in the left side of the body. So what you do, first you grab the skin. So you hold the skin like this, you insert the needle 90-degree angle deep into the muscle, then you release the skin, then you hold the cap of the needle, you pull back the plunger if there's a blood entry. If there's a blood, you remove the needle outside of the muscle, then you start a fresh injection. And if there is no blood, you can give them the medication safely like that without any interruption. So now let us see. As we have said, when in the right side, you give the injection in the outer upper quadrant of the right side, and when you are giving the injection in the left side, you give the injection in the outer upper quadrant of the left side. So this is how you are going to locate the site of a gluteal muscle. So now let us do the procedure. So let me give the injection in the right side of the muscle, of the gluteal muscle. So what I do, I grab the skin like this, then I insert the needle 90-degree deep, 90-degree angle deep into the muscle. So this is how I'm going to do. So you insert the needle 90-degree angle deep into the muscle like this. So you insert, So when you insert like that, you hold the cap of the needle, then you aspirate first. So you aspirate, you withdraw back, you pull back the blunt if there's a blood entry. So I hope you can see I have aspirated, so there's no any blood entry. So I give the injection safely like this. So I give the injection safely like that. Then after you have given the injection, you apply a cotton wool on the area where you have given the shot. So this is how you are going to give intramuscular injection, especially the gluteal muscle. Thanks for your watching. Have a nice day.